All right, let's start the Board of Health meeting for November 21st, 2022, beginning at 5:19 p.m. Chairperson LeBlanc is absent from the meeting today, as is Director Kennedy. And in keeping with an act relative to extending certain state of emergency accommodations, this meeting will be conducted remotely over Zoom. Attendance by board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. To use Zoom, you will need to use the link on the agenda or download the Zoom application and create an account, or use one of the call-in numbers listed on the agenda. You will need the webinar ID to join by phone only. While conducting meetings remotely, we will endeavor to keep meeting operations as close to our standard procedures as possible. However, use of this platform will necessitate some additional meeting protocols. Number one, while the board members and applicants will be on video and audio, public participants will join the webinar as attendee, meaning they are muted and with no video feed from them. During the public testimony portion of the meeting, members of the public can be recognized by using the raise hand function found under participants from Zoom, or make a request with the Q&A function. If you're joining only by phone, you can press *9 to raise your hand. If an applicant wishes to display materials, please make the request of the chair and email the materials to board staff for sharing on screen. When starting testimony, please state your name and address for the record. There is a markup function in Zoom which will allow you to call out specific areas of presentation materials. As in any public meeting, indecent behavior will not be tolerated, and anyone who abuses use of the meeting platform will be terminated from the meeting. Business will be handled at all times indicated on the agenda. Business not concluded in the allotted time will be tabled to the end of the meeting to allow for timely logins and remote attendance. Board members are asked to announce themselves when making a motion and second, so that it will be clear to the audience and minute takers who made motions. All votes will be by roll call. When all business indicated on the agenda has been completed, the members will vote to adjourn the meeting, signaling the end of the meeting and the termination of the ECAT recording. All participants will be discontinued from the webinar at that time. And the first item on our agenda under action and discussion is the DEP request for comments on Easton DPW.
That's actually under variance, I think. Should be under variance.
Oh, okay.
Looking at the old.
I am looking at the old one. Yep.
Yeah.
Okay, so alternative design flow based on historic water meter readings for the town hall septic repair.
Okay, so pretty much what's happening in, I'll give you the nutshell real quick, and then I'll hand it over to Matt from DPW, is we're putting in a new septic system for the town hall. It's on a leaching pit right now. So it's time to upgrade and stuff. So that being said, it's a 13,000 square foot building. Design flow would be somewhere around just under 1,000 gallons, 975-ish. Correct me if I'm wrong, Matt, a day if you do 13,000 times 75 per 1,000 square foot, you get a little over that. There is a provision in Title V that allows you to take a 25% reduction from that number, which would give you approximately 731.25 gallons a day. That's an LUA that's easily done. We've done it when spaces are confining and stuff. There's also a provision in Title V that states that if something is not written in Title V, you can take several years water records, take the average of them and double them, and use that as your calculation of water flow. What they're looking to do, I believe, and Matt, you can chime in as soon as I'm done here, is reduce even below the double. Well, they're going to use double water records. They'd like to do that, but because it is written in Title V, it needs to be a variance and it needs to go to DEP. So they're here today to talk about that and present what their plan is to do. So with that, I'm going to hand it over to you, Matt.
Thanks, Mark. Matt Rochotto with the Easton Department of Public Works. So yeah, basically what Mark had said, we're looking to get a design of alternative design flow for the building. Since it's an unusual facility, it was originally a private residence that was turned over to the town to be used as the town hall. So what we were looking to do was designed the system based on 200% of the 2-year water meter readings of the facility. But when we started to look at that, we started to factor in COVID and potential reductions in the use during the COVID period. So what we actually did is we went back for the 10-year period prior to COVID and based our water meter readings off of that 10-year period prior to COVID. So using that, we get a daily flow of about 156 gallons per day. And then we double that. So we're at like 312 gallons per day.
Okay. Can I, Kristen had sent me a memo and said,
Sure.
The post-COVID, since we've all been back, our new average water meter records are about 185 now a day. So I don't know if that should play into it. Keep going, Matt. I'm sorry to interrupt.
Yeah, unfortunately, we have to use, in order to apply for DEP, we have to use the past 2 years. If you look at the past 2 years, it's really not a good representation, I think, based on COVID. So we went the 10 years prior to COVID, and we come up with 156 gallons per day over 10 years, which is probably a good representation of what the building is actually using. It varies from, month to month probably, but, for a 10-year period, I think that's a good representation what the building's actually using. So, we based the design off of that. And like you said, if we had to do a basic office facility, we'd be around 1,000 square feet or 1,000 gallons per day. Using this, we're at 312 gallons per day. And we designed the system according to that. Based on the test pets we did out there and that you witnessed, the material out there is pretty good. We got less than 2 minutes per inch out there. And we should be able to design it to get 5-foot separation from the water table, so it shouldn't be any issues. I think the only variance we'd probably be looking for would be depth of the structures, because the septic is coming out of the building at such a great depth. We're going to be more than 3 feet deep. And then I think
the tanks, you can only, you'll be
the tanks are going to be, the top of the tanks are going to be like 6 feet in the ground.
Right.
And then there's also a provision in Title V for separation of the invert and outlet of the septic tank. It has to be like 12 inches from ground. And I think we're going to be less than that, so we have to get a variance on that. But that's down the line. I think the only thing we're really focusing on today is the flow.
Exactly.
Alternative design.
Exactly. So DEP is, and this is from Kristen, I'm reading from the text that she sent today. They're really looking for your questions and concerns from the board, because this is a variance, it needs to be from the board. If it's allowed, Kristen said, maybe go with the 185 number. It gives a little more cushion. We've never done this before for any building. But if this building changed use at all, this would be negated. Okay. So if you guys approve this tonight, so this building became retail use, which is actually a lower flow, but it would still be more than this. It would negate it. So if the town ever sold the building, they'd have to go back to the drawing board, expand the septic system to whatever they're going to use. So this is, I believe the intention is to put something in the ground that's not polluting, to keep it above the water table, which is the 5-foot separation, because it's very sandy material, and design something big enough that it won't be an issue here. The water flow isn't really that great, as Matt had said, 156 gallons a day average, which isn't really a lot. Seeing the average home in Easton, a three bedroom home will do 185 gallons a day average, and they're designed for 330 a day. So I'd like to have the board entertain any questions they have for Matt at this time.
Is it a pump system? Is it a pipe and gravel system? Are they the arches?
So it's going to be a pump system, and then we're looking at doing quick force chamber units in the field.
Okay.
So I just happen to have a model of them right here. These are the units, if I can get that in front of the camera, that they'll be using. They have an end cap on them. Like this. The pipe goes in here. It creates a lot of volume airspace, which is good for aerobic digestion of the effluent. And they get sidewall credit. I don't know if at home or you guys can see, my screen is pot blur, but there's little fluted lines here to simulate on the actual chamber. It'll allow water to leachate out the side, so they get sidewall credit. Another thing that lessens the footprint, reduce the cost. So.
I mean, is the major concern with this overflow?
No.
Okay.
I think we need to do this in the proper way. From what Kristen said, is to, checks and balances with DEP, because this is actually a variance. It has to go through you as the board. And it's not saying you're opening Pandora's box, but we haven't done it before. So if you have any concerns like that, now's the time to voice them or whatever. But saying that it will be negated if the change of use, and that's from DEP, that's not from us. They'd have to go back to the drawing board.
Let me ask you this. Is there any harm to pushing this off a couple of weeks until we have Lynn here as well?
This is time sensitive with DEP. That's why we didn't push it off to next December 12th meeting. So it is time sensitive. Am I correct, Matt?
Yeah, so we initiated the application a bit back. We missed a couple meetings, one meeting because of I think a typo or something in the agenda. So the DEP has a window where it can accept comments on the application from the town. So I think we're closing in on that window.
Yeah. So in other words, if it's approved by you, people can put comments in for or against it. And if we don't, we want transparency for the public and, and give them ample time to make comments.
Right. Well, in the as far as transparency goes or whatever, I have no problem like requesting whatever you guys want us to request, but I also feel like you're throwing a lot at Aria and I to digest in a small amount of time, where it's a town building and you've said we've never done this before. So I don't even know where the liability buck gets passed to, but I just don't want to speak out of school or anything like that. I'll be happy to, like, if there's a motion that needs to be made to keep the ball rolling, I'll be happy to. I just kind of voicing how I feel. Maybe that's just a procedural thing, and I understand that there's a time constraint. So, but
Aria?
I'm just wondering, so I'm assuming there's no alternatives to this, right? If there was an easier alternative, I'm guessing you would have gone that route, correct?
Yeah, so this is basically reducing the size of the field by 2/3 based on the designing it based on the actual water meter ratings versus what a strict Title V interpretation of an office building would be. So it's a significant reduction in the size of the field and cost to the town and everything that would go us, be needed for a field that would be 3 times the size of this, including the pumps and the chambers and septic tanks, pump chambers, pumps, everything be 3 times the size.
So, for instance, he can use a 1,500-gallon 2-compartment tank, which ballpark, and Tim, if you've seen the prices on any of your invoices that you see, I believe they're around $1,700 as opposed to going to let's see, if you're doing 1,000 gallons a day, you got to double it. So to a 3,000-gallon 2-compartment tank, which is a lot larger, which is a lot more expensive. Yeah. What's that?
you'd probably be looking at two separate tanks, a 2,000 and then a 1,000-gallon tank. I don't
Yeah.
know what's going on a manhandle. That's
Right, yeah, two tanks in series. So that's a definitely advantage cost-wise. You can still get an H20 loading tank because this is going to be deep. In a 1,500-gallon 2-compartment tank. And there's still going to be a pump chamber involved, which is a separate tank. So it increased the amount of tanks and stuff like that. That's so, it is a cost savings.
What kind of motion do you need us to make?
To approve, the motion would be, you make a motion to approve the allowance of a variance from the Board of Health to use water meter reading records that are doubled as design flow for the septic field for 136 Elm Street.
As provided from the provisions of Title V, correct? Like there are provisions for this?
This is actually a variance from the provisions.
Okay.
Okay. So it wouldn't be from provisions of Title V. If hypothetically, say if I opened the book and there was nothing for office flow, we wouldn't even be sitting here. We would allow, I'll give you an example, tattoo parlors. We started a design flow with them based on hand washing of a doctor. So we figured 8 hours, you see a customer every 2 to 3 hours, and we added up the water flow, and then we doubled it for a tattoo parlor because there's nothing in the book for tattoo parlors. So they allow that provision. There's something in the book for offices. So the offices are a minimum of 200 gallons a day, or once you exceed 200 gallons a day, it's 75 gallons per 1,000 square feet, which in this case would work out to about 975 gallons a day, which would be a very large field, which I think we all understand that that's probably overkill considering we're using 156 gallons a day. You know what I mean? So Title V allows you a provision to reduce it by 25% with a simple local upgrade approval. Wouldn't be a meeting. It would be just done by Kristen. That would bring the volume down to 731 gallons a day. What they're asking to do is go by water meter records, which because it's in the book, it has to be a variance and it has to be approved by the Board of Health.
Okay.
I don't have any more questions.
Me neither. Nor do I have the inkling, will, or memory to make a motion
Okay, I will make a motion.
of what you said. So if I could copy and paste your words, I would.
I will make a motion to approve the variance for the Easton DPW application for assignment of an alternative design flow based on the historic water meeting readings for town hall septic repair.
Second.
All those in favor? Zayas, yes.
Mills, yes.
Great.
Okay. And so that will be not for the 185 gallons that Kristen kind of suggested. It'll be for the 156 gallons, just to clarify. 156 doubled.
I'm whatever
Okay.
Kristen suggested, I'm assuming.
Okay. Kristen suggested maybe going 185 gallons a day and doubling that.
Yeah.
Okay. Which is 370. Or we go with the historic 10-year record, which is what Matt produced, which is 156, and that doubled is 312. We're talking, 55, 56 gallons, it's 58 gallons or something like that.
Yeah, does that change the field that much?
Probably not. Probably
Yeah.
when you do the chambers, Matt, it'll probably end up being a ballpark anyways. So
Should we just be safe and go with what Kristen suggested, not to go against any of you guys?
that's up to you. That'd give a little more cushion, and it's still a
Alright.
pretty small field.
Aria?
Okay, does that roll into the other? Or is this a different motion?
You can amend the motion.
Okay, I'll amend the motion to approve the variance for the Easton DPW application for assignment of an alternative design flow based on historic water meeting readings for town hall septic repair to be 370 gallons per day
Total. Okay.
Second.
All those in favor, Zayas, yes.
Mills, yes.
Great.
All right. I think we're all set, Matt.
Great. Well, thank you for your time.
All right, no problem.
All right, see you.
All right, bye now.
Okay, next on our agenda under action and discussion is COVID-19 updates.
As Kristen's out, all I can give you is a heads up of what we see in our Maven, which is only a case or 2 or 3 a week. Obviously, a lot of people are home testing with antigen tests, and they're not going into the computer system. So we don't have real hard numbers. Kristen might have a little more knowledge of that than Tim and I do at this point. So I know that flu's starting to tick up, and people should be out there getting their flu shots. But, so that's it for right now. We can leave it on the agenda to be talked about on the December meeting and see where we're going from that. We did do a couple of booster clinics. We did one for Vote and Vax, which Tim can speak to because he sat in on that one. I sat in on a booster clinic at Olmsted Richardson School. And some, we captured some teachers probably in the 20 teacher range, 22 teacher range that day. And then Tim did the Vote and Vax one. How many was that, Tim?
We got like 30 at the election day at the high school.
Yeah. And then we held one at before town meeting, and we didn't do any that night. So, but I think people are either they got it or they're not gonna get it. And that's kind of the attitude. And everyone was asking about flu. So hopefully sooner than later, we'll be doing a flu clinic. I think that's in the works, what Kristen said. So that's the update for that.
Great. Next on the agenda is arborvirus updates.
So we've had a hard frost last Tuesday night, and a hard frost is defined as 28 degrees or lower for more than 4 hours. Bristol County Mosquito Control has officially stopped trapping mosquitoes and testing them for the season and won't do it again until the spring. So that'll come off the agenda until the spring, and we will have that off as a discussion item unless you guys have anything on that. So the risk is very low once we have a hard frost for the people at home. So,
Great. Next on action discussion, meeting format, remotely, in person, or hybrid. I would guess we will not discuss this without Lynn here.
Yeah, I think.
Chris, you feel differently?
No, table it.
Yeah. Okay.
And then we have a betterment application for 315 Foundry Street.
Yes, their septic system's in failure. They're asking for $45,000 to upgrade their septic. They have design plans all in. They're just seeking the funding for this. And they're in good standing with the town in terms of their bills.
Motion to approve the betterment for 315 Foundry Street.
Second. All those in favor? Zayas, yes.
Mills, yes.
Thank you.
Next on the agenda, acceptance of minutes from October 11th, 2022.
Motion to accept the minutes from October 11th, 2022.
Seconded. All those in favor? Zayas, yes.
Mills, yes.
Any staff or member notes?
I don't have anything pressing right now. As Tim could speak to, he's kind of a permit guru in the office. We're actually doing a lot of permits now, and we will be till the end of the year. And then we go around and chase some people after the end of the year if they don't get in with their permits, like restaurants and tobacco licenses and food licenses and stuff like that. So that's what we have going on now. Perk tests and stuff have slowed down a little bit, but that's the season. Usually from now until January, it slows down a little bit, and we concentrate on other things like food inspections and stuff. Tim has been working with our grant person that our shared services and food inspector, and setting up Paul with his last name's Galpin with inspections. And I took him out a couple times. Tim's taken him out several times. So we get to see how I do a restaurant inspection, how Tim does a restaurant inspection. And the feedback's been good. I got from one restaurant person, he's like, man, is he thorough, which is what we want. So that's, we have that going on. And then that's about it for right now. So any other questions you guys have? Anything in town you have questions on, Board of Health wise?
I'm good.
All right.
So our next scheduled meeting will be held on Monday, December 12th, 2022 at 5 p.m. And I call to adjourn the Board of Health meeting for November 21st at 5:44 p.m.
Second,
All those in favor, Zias, yes.
Mills, yes.
All right.
Okay, great.
Thank you, guys. I appreciate it.
See ya.
Thank you.
Happy Thanksgiving.
Yeah,
Happy
you too. Have a great
Thanksgiving.
Thanksgiving, guys. Enjoy your families.
You too.
Good night.